Health and safety for domiciliary carers. Introduction. What will be covered? Management of health and safety. Moving and handling. Moving and handling arrangements. Moving and handling equipment. Key points to consider. Slips, trips, and falls. Controlling the risk. Reporting of injuries, diseases, and dangerous occurrences regulations, REDOR. What is REDOR? Why report? What must be reported? Types of reportable injury. Control of substances hazardous to health, COSHH, regulations. Choosing control measures. Waste management. Handling waste. Management of health and safety. Care homes differ from other workplaces because they are not only places of work, but are also homes for their residents. It is therefore important that they are pleasant places where the freedom and dignity of residents are respected and where everyone's health and safety is sensibly and effectively managed. Social care is about people, a large, diverse workforce looking after a predominantly vulnerable population. Employees have the right to work in a healthy and safe workplace, while residents should receive care that is safe and takes their needs, freedoms, and dignity into account. Managing these different needs will sometimes present unique and complex situations which can, when not effectively managed, result in serious harm to employees or residents. You need to be aware of the different risks and control them effectively. Good management of health and safety does not happen on its own. You will already have management processes to deal with payroll, personnel and finances. Managing for health and safety is no different and should be an integral part of the everyday running of your care home and the behaviors and attitudes displayed by all. The core elements that are required to help you manage for health and safety are: good leadership and management, a trained and skilled, competent workforce, an environment where people are consulted and feel involved. Managing for health and safety requires a sustained and systematic approach. While this may not always require a formal health and safety management system, your approach is likely to follow the steps: plan, do, check and act. Plan. Say what needs to happen and say how you will achieve it. Do. Profile the risks you identify, organize your activities to deliver your plan, decide on the preventive measures, and ensure there are systems and equipment in place to do the job safely. Check. Monitor the work to see if it's being done safely and investigate the causes of accidents, incidents or near misses. Act. Review your performance and take action on lessons learned, including from audit and inspection reports. Moving and handling. Helping residents is a key part of the working day for most care home employees. A significant number of injuries to staff are caused by moving and handling people. Some residents may need assistance to move around safely and to participate in activities. Others may be dependent on staff for bathing, dressing and other tasks which involve moving and handling. Poor moving and handling practices can lead to back pain and musculoskeletal disorders, which can result in disability and people being unable to work. Accidents, which can injure both the employee and the resident being moved. Discomfort and a lack of dignity for the resident. Work in care homes can also involve many other handling tasks, such as lifting, moving, putting down, pushing, pulling, carrying loads and equipment in laundry or kitchen, stores cleaning, maintenance activities. These also need to be managed to reduce the risk of injury and musculoskeletal disorders. Moving and handling arrangements. Things you will need to consider when looking at your overall moving and handling requirements within the care home include the type and frequency of moving and handling tasks, the range and amount of equipment needed, equipment storage and maintenance, staff required for moving and handling, and their competence and training, the environment, for example, flooring, ramps, lighting, space restrictions, etc. Moving and handling in the event of emergencies, such as fire evacuations, residents' falls, etc. Moving and handling equipment. The types and amount of equipment needed will vary according to the dependency and specific needs of residents. Equipment typically can include a selection of hoists, for example, bariatric hoists, hoists to raise fallen residents from the floor, standing aids, mobile hoists, bath hoists or lifts, adjustable height baths, etc. Slings of different types and sizes to meet residents' needs. Slide sheets and transfer boards. Turntables. Electric profiling beds for dependent or immobile residents. Wheelchairs. Handling belts to assist weight-bearing residents, not for lifting. Lifting cushions. Support rails or poles. Emergency evacuation equipment. Suitable walking aids, handrails, etc. for mobile residents needing minor assistance. Key points to consider. Have you assessed all hazardous moving and handling tasks carried out in the care home? Do you have person-centered moving and handling plans in place? Are plans specific about different handling tasks and the equipment to be used? Are plans reviewed periodically, and when the person's needs change, for example, when they become less mobile and more dependent? Are staff competent to carry out moving and handling techniques safely? Is sufficient and appropriate moving and handling equipment available? Do your monitoring arrangements check that safe techniques and equipment are used? For example, do you ensure that staff are using the right slings for the resident? Slips, trips, and falls. Slips, trips and falls can have a serious impact on the lives of employees, and they can also impact on those being cared for. People who live in care homes can be particularly vulnerable to injuries from falls. Many factors can cause slips and trips. The practical measures needed will vary in different situations. Some of the main causes of slips and trips accidents include slippery or wet surfaces caused by water and or other fluids, slippery surfaces caused by dry or dusty floor contamination such as lint or talcum powder, obstructions, both temporary and permanent, trip hazards, uneven surfaces and changes of level, for example, unmarked ramps, poor levels of lighting. Controlling the risk. You should identify any individuals who are at particular risk, and then put suitable and adequate control measures in place. Factors to consider include the following. Age-related physiological changes. Age can increase the risk of falls, in other words, deteriorating vision, impaired judgment and memory, altered mobility and increased frailty and dependence. Falls may arise from weight shifting, trips or stumbles. Medical conditions. Certain conditions may increase the risk of falls, in other words, strokes, dementia, fits and faints, low blood pressure, and urinary infections. Medication. Certain medications may increase the risk of falling. Older people may have increased sensitivity to medications such as psychotropic drugs, sedatives, analgesics, beta blockers, antidepressants, diuretics and antihypertensive drugs, which can all cause a particular problem. Floors. Slip-resistant flooring should be used in bathrooms, kitchens or where surface contamination cannot be effectively controlled. Change in floor surface, for example, stepping from carpet to a smooth floor or vice versa, can cause stumbles and slips, especially for people with impaired vision or mobility. Contamination. Contamination can include food, liquids, urine, talcum powder, leaves and dirt from outside, and cleaning substances, etc. Consider how you can prevent floors getting contaminated so far as reasonably practicable. Obstacles. Floors should be kept free from trip hazards and obstructions, for example, avoid trailing wires and ensure equipment is stored away, when not in use, rather than left in walkways.